Greetings, this is Steve Horan with your QI Plus support team. In this brief video, we would like to introduce you to design thinking for quality improvement. And as always, we'd like to thank CPCA for making QI Plus possible. How does this machine make you feel? Think about it. What if you were 6 years old and you were faced with going into this machine? Or you were the parent of a 6-year-old faced with going into this machine? How would that child feel? How might you feel? What if a child became so scared and upset that the child had to be sedated in order to go through this machine, which actually happens quite often? Now, by comparison, how does this feel? Looks like a fun ride at an amusement park to me. And the difference you see between that initial intimidating, daunting view of the machine and this redesigned view of the machine is attributed to design thinking. And we encourage you to check out this video. We've got a link here to a video from the Children's Hospital of Pittsburgh where they actually talk through the design thinking process they went through to convert from a scary experience with that machine to a much more welcoming experience that actually involved the whole staff and making this a positive experience for kids. And so what is design thinking really? Well, here's one definition. Think of design thinking as a team process for creative problem solving based on human-centered design principles. You can use design thinking in quality improvement to solve complex process challenges that affect multiple people. Design thinking is really made for fairly complex process problems. And it assumes that when you have a complex process, there's multiple people involved. And it assumes that those people have thoughts, feelings, insights, and ideas that can be invaluable for optimizing that process. And the good news is design thinking is not that hard. It takes a little practice, but really any team that's willing can apply design thinking by following a 5-step design process. And here are those steps. This is a familiar model of design thinking that you will see all over the web. There are other ways of approaching design thinking. This one was popularized by a firm called IDEO and also the design school at Stanford University. And the first step in the process is to empathize, meaning develop a deep understanding of the user experience. This is the difference in design thinking compared to several other models of process improvement. It starts with the human element and sustains the human element throughout. Based on what you learn through empathizing, now you're ready to define the problem to be solved. And we're only identifying problems at this stage. We're not jumping to solutions yet. We want to identify all the problems and then choose the ones that we think need to be solved and that we have a chance of solving. Then we move to ideation. In the ideate stage, we brainstorm potential solutions. This is a very creative process, and it works best when it's done with an initial burst of ideas, non-judgmental ideas, get everything on the table. And then the real fun happens when you start to see ideas intersect and interconnect so that a cluster of ideas may accomplish way more than any of those individual ideas would have done on their own. Once you pick a few solutions that you think might work, you can go to the prototyping phase. And in prototyping, we're really looking at simple prototypes for quick testing and rapid learning. This is another key differentiator in design thinking. It's a quick process and it's a rapid process, and we prototype quickly and in some very rudimentary ways sometimes. And that's actually very strategic because what we're looking to do is try different ideas, but to fail quickly and to fail cheaply. And every time we fail forward. We learn something that we can use in the next prototype. Once you feel like you have a pretty good prototype, you can go ahead and test it. And this is very important here, to test it with the people involved. In a health center, that might be patients, that might be clinicians, that may be other team members. Get their feedback on this prototype before you move to implementation and then optimizing your best solution. So this is kind of the classic 5 steps in the design thinking process. So we should ask, how can this be used in healthcare? And this is just one article. There are many out there, but this was a pretty good one in recent. The folks at New England Journal of Medicine Catalyst surveyed over 600 clinician leaders, clinicians, and executives in 2018, and they asked them, how useful is design thinking for your organization? 36% said extremely useful, 29% very useful, 26% useful, and only 9% said it was not very or not at all useful. The same survey asked folks to identify the top 3 issues that would benefit the most from design thinking. And as you scan this list of staff and provider flow and scheduling patient appointments and reducing no-shows, improving patient adherence, improving patient satisfaction scores, improving patient flow, communicating with patients, patient health literacy, decreasing waiting time, how to use office space. All of these topics are very much in line with things that we deal with through quality improvement every single day. So there really is a good fit between design thinking and healthcare, and then within healthcare, there's a good fit between design thinking and quality improvement. So let's talk a little bit more about how to get started with design thinking. It really helps to remember these core values. As I mentioned earlier, it's a people-first or human-centered approach. So the first priority is to understand how people think and feel about the product or process as it is and how it should be. Next, teamwork is key. Design thinking works best when everyone on the team is given an opportunity to contribute. The best work happens when everybody around that table feels comfortable about contributing ideas. And that means creativity is welcomed in design thinking. Everyone should feel comfortable voicing ideas without fear of being judged or put down. And the next core value is failing forward. It's expected that any design team will generate ideas that ultimately don't work. The key is to fail quickly and cheaply and keep learning on the way to the best solution. And finally, ego is an obstacle. Design thinking is about getting it right, not being right. The best ideas can come from anyone, anywhere in the team hierarchy, and we see this happen all the time. The aim of design thinking is really excellence, and we might define excellence in terms of 3 attributes. We want a design solution that is desirable. The people involved should want this solution. It should be feasible. It should be feasible, practical to implement in your particular setting. And it should be viable, and this one is often overlooked. It's important to think about solutions that could be sustained and scaled over time. Sometimes those solutions are not immediately apparent, but as you go through the process of empathizing, defining problems, generating solutions, it really does help to remember that we're looking for something that is desirable, feasible, and viable. So to get started with design thinking within your health center, the first thing you do is define the challenge. What's going to be the focus that you will be, the focus or the challenge that you will be attempting to solve? That's first. Second, engage a team. Depending on what that challenge is, think about a small team of people who can bring insight into the patient and provider experience as it relates to the particular process or product you are aiming to improve. Third, define the aims. Define your aims again in terms of a solution that is desirable, feasible, and viable. And fourth, apply design thinking. Follow the 5-step process. And you can do that as a whole team, and it's actually a lot of fun. So let's look at an example application. Here's our model again: empathize, define, ideate, prototype, and test. Let's apply this to a challenge. And that challenge, for sake of illustration, is planned visits for patients with depression and diabetes. At Community Health Solutions, we've been working for almost 2 years now with a group of clinics who are trying to do just this. And the first thing we want to do is define the challenge. So how can we optimize pre-visit planning and visit flow for our patients with depression and diabetes? That's our challenge. Second, engage the team. Let's engage a small team of people who can bring insight into the patient and provider experience as it relates to planned visits for patients with depression and diabetes. Third, let's define the aims. Let's agree that at the end of this design thinking process, we want a planned visit experience for patients and providers that is desirable, feasible, and viable. We've defined the challenge, we've engaged the team, we've defined the aims. Now we're ready to apply design thinking. So remember, our first step is to develop a deep understanding of the user experience. Here it's important to think about who is involved: patients, clinicians, other team members, etc. Anyone who is affected by the planned visit process or has an influence on the planned visit process is a candidate to learn from during the empathy phase. So, bring the team together and ask, how does our pre-visit planning and patient flow work right now? And ask, what do we know about how our patients think and feel about their pre-visit planning and their visits? What do we know about how our team members, clinicians and others, experience these same processes? What more do we need to learn? Should we talk to or survey a small group of patients or providers to get their perspective on planned visits? Then, capture your current process for pre-visit planning and visit flow in a process map. This is the situation as it is right now. Also, capture your insights about patient and provider experience in a set of notes and summary report. And again, at this early stage, it's important to consider whether you need to go out and talk to some people before you continue with the design thinking process. Once you've gathered the information you need in the empathize stage, we can move to clearly defining the problem to be solved. Here we ask, what are the problems that people experience, and which of these problems should we focus on solving? You can focus on more than one problem at a time, but it is important to break those problems out because a sequence of problems, each of those may have a different solution. And so it is important to kind of break things down into their sub-elements when you're defining problems. So as a team, sit down together, review insights from the empathize phase. Then go to work on identifying specific problems experienced by patients or providers, and then work together to decide which are the priority problems to be addressed. This is important. Don't try to solve anything yet. Just define the problems at this stage. Jumping to solutions too soon can actually cut you off in the creative process. Then capture results. Create a list of priority problems to be addressed. And typically during this definition phase, this is when the team starts putting up Post-its, developing an inventory of all the problems. Then you can move those Post-its around, group them together. You can find clusters of problems. And that really is helpful in our experience for helping folks not only understand the scope of problems, but also decide priority problems that need to be addressed and can be addressed. Now that you have your problem list, the fun part starts. So Dr. Einstein reminds us that we cannot solve our problems with the same thinking we used when we created them. And another important principle of design thinking is that it is not only helpful, but actually encouraged to think about solutions that build on things you see in other fields. In other words, when you sit down together to brainstorm possible solutions, don't be afraid to bring in external examples, such as a pit crew. If we were able to work like a pit crew, how would our planned visit process be different? Is one question you could ask during this brainstorming process. And then just invite ideas and let the ideas flow. Don't judge the ideas, don't rule any ideas out. Keep going until people have exhausted their list of ideas. So to do this as a team, bring everyone together, brainstorm possible solutions to each problem. Again, remember there's no judgment at this stage and there are no bad ideas. Remember that many of the best ideas are off the wall, and that's okay. Those insights that borrow from settings beyond healthcare are sometimes the best catalyst for really great healthcare solutions. And then once you get all your ideas up, look for areas of synergy between solutions. This is where a lot of really good solutions are found. There may be 3 or 4 ideas that individually don't quite get us where we need to go, but if we put those ideas together, we actually have a synergistic solution that has a good chance of working. Then you want to capture these results, create a list of possible solutions for each problem. Keep it fairly general at this stage. You can prototype actual solutions in the next step. Again, this is a point in the process where it can be really helpful to use Post-it notes, put solutions up on the wall, cluster them, see what you have in terms of 3 or 4 solutions that you could try to improve the planned visit process. Next, we want to develop simple prototypes for quick testing and rapid learning. These photos are important. Some of the best work in design thinking workshops happens on the tabletop with simple tools like paper clips and tape and popsicle sticks and glue and process charts with sticky notes, and it helps to have a ninja attitude. Okay? Try to strap together anything. It doesn't need to be artistically beautiful. You can draw a stick figure if you need to, just like this little ninja here. The main thing is to put the idea across in something that's visible. So in our planned visit process, we'll definitely want to be mapping out some solutions using process charting. But we also might want to mirror some patient-provider encounters during that process using the tools available. Or we might want to use popsicle sticks to do a prototype physical layout or design of our office space. So the sky is the limit here in terms of your creativity for prototyping. The key is to do it quickly, and again, fail early, fail cheap, and keep learning on your way to a solution. So as a team, everyone gets together and you say, we're going to design 1 or more simple prototype solutions for each problem. Again, keep it simple, draw pictures, use mock-ups, create storyboards, whatever it takes. Then test each prototype with the people involved and invite honest feedback. And you can go to them with something that's pretty rudimentary and get some immediate feedback. You learn quickly, you refine it a little bit, you make it better. Then choose 1 prototype solution for implementation. Now, when you go to implementation, you're starting with a prototype and you still have to prove that it works. So we're going to test a prototype or a couple of prototypes. To do that, you share the chosen solution with the team. Think about starting small and expanding over time. Think about whether you need to facilitate training, tutorials, coaching, and technical assistance to actually get this implemented. Test it and refine it as you go. It is almost always the case that even a well-developed prototype needs further testing and refinement in implementation. And then continue to talk with people, optimize implementation in response to feedback from patients and team members. So congratulations, you're now a design thinker. Remember, design thinking is a team process for creative problem solving based on human-centered design principles. And in this brief video, we've learned the 5-step process for design thinking. Empathize, define, ideate, prototype, and test. So let's talk about time requirements. This is a common question. How much time should we devote to design thinking? Well, the time required will really depend on the project and the team. But it might help to think in terms of classic design thinking and the design sprint. In a classic design thinking exercise, there is some time required at the front end to develop a deep understanding of the user experience. This can be accomplished with individual interviews or group meetings with patients, providers, or both, and sometimes surveys can be used as well. So a classic design thinking project might require 3 or 4 team meetings of, say, 60 to 90 minutes over a 1 to 2 month time frame. The design sprint is a quicker approach. Think of a design sprint as a rapid application of design thinking. A design sprint can often be completed in 1 or 2 team meetings of 60 to 90 minutes. Here's the key. A design sprint is an option if you are confident that the people on the design team already have a deep understanding of the user experience. Then you don't need the time required to do the research under classic design thinking, and you can jump right into empathy, define, ideate, prototype, and testing. Also, there are some good resources out there to learn more about design thinking, and we encourage you to pursue these resources. We curated these. None of them is especially long, and we think they all do a good job of providing solid background on design thinking and how it can work in healthcare. So we thank you for being with us, and we hope you will consider using design thinking for your quality improvement work. As always, your QI Plus support team is here to answer questions and provide whatever other supports you may need to put design thinking and the other QI Plus tools to work. Thanks for being with us, and we look forward to talking with you soon.